How is expressive language disorder diagnosed? Have you ever wondered how professionals identify expressive language disorder in children? Understanding this process can be essential for parents navigating their child's communication challenges. Let's break it down step by step. First, the evaluation begins with observing the child's language skills. Professionals look for signs like a limited vocabulary, difficulty forming sentences, and frequent grammatical errors. For instance, a child might struggle to use the correct tense or have trouble recalling words. They may also use vague terms, speak in short sentences, or hesitate when trying to express their thoughts. These behaviors are compared to what is typical for children of the same age. Next, standardized testing comes into play. Speech-language pathologists or other qualified professionals administer tests that measure expressive language abilities. These tests assess vocabulary size, sentence structure, and the ability to engage in conversations. The child's scores on expressive language tasks are compared to their scores on receptive language tasks, which involve understanding language and their nonverbal intellectual abilities. A significant gap, where expressive skills are notably weaker than receptive skills, supports the diagnosis. Another important aspect is assessing the impact of these language difficulties on daily life. The evaluation considers whether the child's challenges interfere with academic performance, social interactions, or other areas of functioning. For example, a child who struggles to communicate effectively might have trouble making friends or participating in classroom activities. Additionally, professionals must rule out other conditions that could explain the language difficulties. They ensure that issues like hearing impairments, neurological disorders, or intellectual disabilities are not the main cause. If such conditions are present, the language problems must be more severe than typically associated with those conditions to confirm expressive language disorder. Finally, gathering a developmental history is essential. Parents and caregivers provide information about the child's language development milestones and any concerns they have about communication skills. Symptoms usually begin in early childhood, making this information vital for an accurate diagnosis. For families, this diagnostic process is important. It helps parents understand their child's communication challenges and seek appropriate support. Early and accurate diagnosis allows families to access interventions like speech therapy, which can improve the child's ability to express themselves. This support can lead to better communication within the family and reduce frustration or behavioral issues that may arise when a child struggles to express their thoughts and needs. Understanding how expressive language disorder is diagnosed can empower parents to take action and seek the help their child needs. With the right support, children can thrive in their communication skills and enjoy more fulfilling family relationships.